Good morning, everyone. Welcome to our local Aging and Disability Action Planning Grant Program listening session. I see the numbers rising, so I'm going to give it a few more seconds for folks to be able to log on and get their audio working. My name is Amanda Lawrence. I am the project director for California's Master Plan for Aging. And I work at the California Department of Aging in our Division of Policy, Research, and Equity. So we'll go ahead and get started with a few logistics, some housekeeping here. We'll welcome everyone. I want to let everyone know that we do have ASL interpretation this morning, as well as closed captioning is available to you if you just click on your toolbar on your Zoom screen. We are recording today's session, and we want to do that so that folks who did not make it to today's session can have access to it, or if you'd like to revisit it. We'll be posting the webinar on our YouTube channel, but additionally, we also have a web page set up for our grant program, and it will include today's recording, today's slides, and our transcripts. So we are in listening mode today. We are going to be talking about the local Age and Disability Action Planning Grant Program request for applications. So we are in the process of designing this RFA and the program itself. So we're here to learn from you. Today, we're going to provide a series of questions and solicit your feedback because you are the experts. We want to hear from folks who are actually doing the work locally to create age and disability friendly plans. Because it is a competitive grant process, we want to ensure that it is a fair process. So today we are unable to respond to any comments or questions, but we will be collecting your questions and be posting them to our grant program webpage. And again, of course, you can always email us, but we also have an additional avenue for feedback, which is a survey that we've developed. It is available on our website, but we will also email all of the folks who have registered today. Following this webinar, you'll receive a link to that survey. So how do you participate today? Typical Zoom etiquette, you have all been muted upon entry. In order to provide any input, you can go ahead and use the Zoom chat feature, or you can raise your hand and the moderator will announce your name and unmute your line. But if you are joining just by phone, if you're in listen only mode, go ahead and hit *9 on your dial pad and you'll be added to the queue, and we'll call out the last 4 digits of your phone number to unmute your line and allow you to make your comments. Next slide, please. So here's today's agenda. We're going to provide just a really quick overview of the Master Plan for Aging. We're going to provide a summary of our grant program, and then we're going to gather feedback from you, and then we'll talk a little bit about next steps. So I'm going to go ahead and share a bit about California's Master Plan for Aging. Likely you've all heard about it. I hope you've read the plan and visited the website, but because of this 10-year vision for building the most age and disability friendly state in the country, we have been given, and we're so grateful for it, $4.5 million to launch a grant program to support local planning, to sort of replicate what we did at the state level, but make it more appropriate for your community's unique needs and assets. So on the next slide, there is an overview of how we develop the plan. And I just want to focus on that this morning, because that's really what this grant program is for. It's for helping communities to develop their own action plan. And so you likely would replicate quite a bit of what we did at the state. So we had over a year of really intense stakeholder and public engagement in order to collect input and feedback on how best to create a master plan for our state. And we did that through public participation in meetings, through surveys, and through many, many webinars. We also had 4 stakeholder advisory committees comprised of people from all across California who shared their expertise and provided hundreds of recommendations to the administration on how best to build out this master plan. And we also hosted several community roundtables with legislatures around the state. And very importantly, we had a cabinet work group This work group was comprised of leaders from across the governor's administration. And so just like we did at the state with really aligning people across various sectors and really gaining buy-in from legislatures and partners and state leaders, you would likely have to do this at the local level to execute a successful local age-friendly plan. In addition to this plan, the governor also called for us to build out a data dashboard for aging and a local playbook. Now, I hope you all have had a chance to check out the local playbook. It is available online. Our next slide shows a few highlights of our local playbook. Actually, could you, forgot. How did we end up with these 5 bold goals? It was because of all that public and stakeholder input. So our master plan is comprised of these 5 bold goals: housing for all ages and stages. That also includes not just housing, but accessible transportation and emergency preparedness. Health Reimagined really covers aspects of healthcare, public health, Alzheimer's, and dementia. Goal 3, inclusion and equity, not isolation. This covers areas such as cultural competency and language access, but also prevention of elder and disability abuse, neglect, and exploitation, as well as building out opportunities for true social engagement, really fulfilling engagement for people throughout the entire course of their lives. We also built out this goal, caregiving that works, which addresses both informal and formal caregiving. So that's the direct care workforce, as well as friends and family who are caring for loved ones. And Affording Aging covers topics such as preventing older adult homelessness, ensuring food security, and protection from poverty. All right, next slide, please. So the local playbook that I mentioned, this is the cover page to it. We built this out over 2 years ago because the master plan was launched in January 2021, and it launched with this local playbook. And my co-presenter today, Jackie, is actually refreshing this playbook over the next couple months to add new resources. But go ahead and check out the next slide, please. Gives you an idea of what it looks like. You can go onto our website. We have a website just for the playbook, and you can use all the resources, access all the resources via our website, or download a copy of it. But we do have many updates and kind of a refresh happening at the moment. So please check back on that playbook. Next slide, please. Key component of not just the playbook, but the master plan is that we have a data dashboard for aging. And this is a fantastic resource for both state and local communities. It helps us track our MPA progress toward our goals. And it has nearly 4 dozen indicators at this point that come with visualizations. But what I really like about it, the most right on the front page, is this demographic dashboard. And that's sort of what this slide pictures. It is available at county level, and it's just a great way for you to get a high-level snapshot of the demographics within your county when it comes to older adults. So it includes information such as language spoken at home and education level, ages, race, ethnicity, income, and more. So many valuable bits of demographics that you can print out and bring to your local leaders and planners and really zone in on what that older adult population looks like in your county. Next slide, please. So I'm going to pass it over to Jackie Tompkins, my colleague at the Department of Aging. Jackie is our Master Plan for Aging senior strategist and is building out this program with me. So Jackie, are you on the line? There she is.
Yes, I am. Thanks, Amanda. As Amanda shared, the Budget Act of 2022 did allocate $4.5 million of one-time funding from our general fund for 3 years to the California Department of Aging. This is going to enable us to provide competitive grants to support local jurisdictions build out their own age and disability action plans. We're seeking at this time to award up to $125,000 per jurisdiction for the total project period, and seeking to award up to 36 jurisdictions with these funds. Next slide. When we think about our grant program priorities, we're really centered on equity, cultural competency, as well as community engagement and meaningful engagement activities. We're really seeking to support communities and populations that have been historically underserved and under-resourced. And this includes smaller population communities, rural communities, tribal communities, people from racial and ethnic minority groups, people with disabilities, and our LGBTQ+ communities. We are currently in the process of building this grant program, as well as the request for applications, and seeking to release the request for applications in early 2023. So at this time, we want all of you to share your knowledge, share your experience and expertise with us. We do have a few questions and prompts as we go through the course of today's listening session. And this is just an overview of the categories we have. Amanda and I will be popcorning these questions so we can go back and forth. So we're really looking at areas for you all to tell us what are some characteristics of an applying organization that is helpful. How do we work in equity and cultural competency principles? What are your feedback and thoughts on some of the funding prioritization as well as scoring incentives? And then we have some additional questions related to administrative and fiscal reporting, as well as want to get some insights on grantee activities and resources. The questions that you are going to see today, we, as Amanda shared, have a post-session survey, so you can add to your thoughts today or even share that opportunity with your networks. So you can come back and revisit these questions. It's really an opportunity for us to hear from you, use it as a brainstorming session, and we are going to open up the lines in terms of if you would like to provide feedback, you can use the Zoom chat function, or you can also raise your hand and we'll unmute your line and you can let us know your thoughts verbally. So we're going to take a moment to look at the first question, allow you some time to digest that question, and then let us know your thoughts. So this is related to characteristics of an applying organization. And we're interested in hearing what characteristics of an applicant demonstrates they have the readiness to plan and develop a local age and disability friendly action plan.
It looks like we have a couple folks with their hands raised. Pauline Martinez.
Hi, can you hear me?
Yes.
Oh, good. A couple different thoughts on this one. I think it's really important that the applicant agency has existing strong partnerships with other aging services providers and key stakeholders in their region. I believe they should also have experience engaging with local electeds, whether that be the County Board of Supervisors or on a more local level, their city council or their city mayor. I think that's a great way to ensure support from the leadership and to tie into other community initiatives. Another idea is having an established track record of program implementation and managing grants. And experience gathering community input via surveys, town halls, listening sessions, or focus groups. Because as you mentioned with the statewide MPA, it was so important to get that community input and local input to support the plan. And then also kind of a nice to have, I think, is a track record of volunteer engagement, because so many of these age-friendly initiatives are really it's not just kind of a top-down approach, but also engaging volunteers at the community level. So I think that would be another great characteristic.
Thank you so much, Pauline. Could we open up Tori Lanala's line?
Thank you.
Yeah.
Can you hear me?
Yeah.
Good.
We can, thanks.
I align myself with the previous speaker's comments, and I'd also like to add that the organization master plan, for instance, our local organizations that have kept up with working and providing feedback that's now in the master plan. And also, when we consider grant opportunities, what have we tried that hasn't worked before? We should learn from our failures and incorporate why now is different. So we give some thought to that as well. Thank you so much.
All right. We have some feedback in the chat, but I believe that's all we have for live feedback. So I think we can move on to the next question. All right. Our next question applies to the characteristics of an applying organization. What are characteristics of an applicant that demonstrates they can facilitate community engagement to plan and develop a local age and disability friendly action plan? Hallie Peterson.
Can you hear me now?
Yes.
Perfect. Just building off of what Pauline has shared, I think that the applicant entity needs to demonstrate that they have the ability to go into very diverse communities within the region that this new Aging and Disability Action Plan would cover, to recruit actual individuals to share their experience, the ability to hold focus groups, conduct interviews, and then to be able to synthesize that information to ensure that they can appropriately capture the voice of those in their community. I think that would be quite important to be able to demonstrate.
Thank you, Callie. All right. I see some more comments in our chat, but I think we can go on ahead and ask the third question. And at any time, if you guys think of answers for previous questions, please just enter into the chat.
So looking at our third question, this again is also related to the characteristics of an applying organization. What are your thoughts, and share with us, what are some characteristics of the applicant that demonstrates they have a commitment to implement and sustain a local age and disability friendly action plan? And it looks like Vicki Vickers, can we unmute her line? And then we'll have Pauline in the queue.
Okay, I think that that is one answer to me, and that would be a proven track record of service to the disability and senior community.
Yeah, just to
Thank
add.
you.
Mm-hmm.
Just to add to my comments earlier, I think also support from the agency's leadership. I think so many times we see one person driving an initiative and then there's staff turnover or change in staff. And so I think having, not only partnerships with other agencies, but also support within their own agency from the top.
Some comments coming in the chat, recognize Board of Supervisors buy-in, as well as other key implementation partners, identifying what has been implemented in the past and what has worked out. What else do we have here? Okay, successful community partnerships. Long-term partnerships with community-based organizations, successful awards from multiple funding sources to support development of new programs that lead to sustainable programs. Agree that buy-in from leadership is required. Those are a couple of the comments in the chat, and I see that Carolyn Nava has raised her hand. Go ahead, Carolyn. Oh, she's muted.
Good morning, thank you. I think I'm unmuted now.
Yes.
Oh, perfect. These are all great recommendations. I just do have one concern. Oftentimes, there are definitely smaller agencies who don't have the history or impact that some of the larger organizations may have. And the criteria is set so stringently that they cannot even apply. And I think that really is something to factor in the rural communities. There are a lot of small agencies who have done amazing service, but they don't have the grant history background. They don't have these high financial profiles that some of the larger organizations coming through that will be applying will bring to the table. And these are some of the service organizations that we have been working with in the northern counties that are now saying, how do we get a piece of this? How do we show that for the last 20, 30 years, we've already been doing this? And the only thing that stops us from doing more is access to funding.
Thank you, Carolyn, for your comments. And Ophelia. Can we unmute Ophelia? Ophelia, sorry.
Sorry, I think I'm listed as Ophelia, but
Yes.
I know she's on the meeting as well. I'm actually a colleague of Ophelia, and I think I very much agree with just the previous comment that was mentioned. And I want to add to that we've been recently talking about, we've been looking at grants for older adults and how to support that community. And what we've been seeing is that a lot of the grant requirements are requesting for innovative ideas. And what we've been really having a discussion with and kind of grappling on this verbiage is that most often innovative ideas for rural communities like ours is really to provide the basic needs for many of these communities. Innovative for them is like having internet, and some don't have internet, some don't have transportation to get from their rural housing location to the nearest hospital, which is most likely an hour away. So I just joined in the meeting, so I'm not sure exactly what the requirements are for this grant opportunity, but I would like to express it and just see how organizations like ours can be supported without really thinking of these basic necessities for many of our older adults.
Thank you for your comments. Carolyn, is your hand up again okay, took it down. Okay. We do have quite a few chats in the chat log here talking about the ability for more established agencies to partner with smaller agencies for sustainable collaboration. Applicants need to demonstrate collaboration with other orgs, city, county agencies, community-based organizations, universities. Collaboration is key. Focusing on underserved communities. May need special considerations for rural applications. And I'd like to see that grant recipients have demonstrated experience with or a commitment to serving adults with intellectual and developmental disabilities. Many policymakers believe that adults with IDD are served by DDS, but DDS only serves approximately half of adults with IDD. And Carly Pacheco says, some communities may have already been able to develop a plan or have made significant progress through investment of local resources. However, implementation and sustaining progress is costly. The ability to use these funds not only to develop a local playbook, but also implement those initiatives and monitor them over time would be valuable. Wow, so many comments coming in. Thank you so much for all of this, all of your input here. We're saving this chat log. We will bear all of this into consideration as we build out the request for applications. So we don't have the specific criteria developed yet. That's why we have you here today to help us inform what is the funding and eligibility criteria. Oh, Will,
and it looks like, Amanda, we have one more. Yes, Will.
Good morning. Can you hear me?
Yes.
Yeah. So I think that you are able to facilitate communication between interested parties through this process. if you're going to have letters of interest, if you're going to have a bidders conference, in this format, we can't see who else is on the line, but going forward, to facilitate potential conversations, collaborations, partnerships, joint applications between larger entities like agencies on aging, like independent living centers, and smaller CBOs. If we know who's in the room, who's expressing interest in doing this, and have some contact information, then we can talk amongst ourselves. Just heard Carly Pacheco, she's in our service area, but there's also 50 other organizations in our service area. So now I can follow up with Carly, but I don't know who else is listening in, right? So that's all.
Diane Lawrence.
Helps if I unmute. I just wanted to say that I think having an idea of who's on these calls, since so many people in the chat have talked about mentoring and being able to pair and learning from others' experiences, both positive and more challenging. I think that helps build those mentoring and that collaboration. And where, if there were the possibility to do some sharing of services or sharing of information, especially in geographically similar areas, that might help the money be used more effectively in the community and serve a broader population in the state.
Thank you, Diane. Callie.
Hey, everybody. I'm going to put a link in the chat, which is to the SCAN Foundation's page that focuses on funding we provide to 20 regional coalitions. My guess is that many of the organizations on today's call are connected to one of those coalitions. I guess my expectation is that you would already know that, but I know that coalitions go through their own process. And I would just elevate that all the regional coalitions have current grant funding from the SCAN Foundation to hold an event around the Master Plan for Aging, which is certainly connected to this work, Amanda. So I would encourage all the organizations that if you are part of a regional coalition, that you guys have a discussion about this opportunity to be thoughtful as you move forward.
Thanks, Callie. I think Carolyn's hand is up again.
Yes, thank you so much, Amanda. And I'm just going to follow Callie because I agree, as the chair for one of those coalitions that the SCAN Foundation has supported for many years. We are in deep discussion about this offering, and to be able to see who in our communities is actually on this call and interested would have been very, very helpful for us in follow-up. We have meetings going on in collaboration in conjunction with this RFP launch that many of our coalition constituents are going to be reaching out for. And it would be helpful for us to have some sort of platform to connect with each other post this conversation so that we can make sure that there is that true, if I can use these coin words, equity and inclusion as these groups move forward. Some of them are quite small and just don't have the resources or wherewithal to be able to even apply here. So we've come together as a coalition to say, how can we make this happen for our community with some of these lesser known agencies that really are doing amazing work in our rural areas.
Thank you, Carolyn, and thank you everyone for your comments. We are going to move on to question number 4, which is related to equity and cultural competency. What recommendations do you have for CDA to ensure that the selected grantees embed equity and cultural competency principles into the planning and development activities of their community's local age and disability friendly action plan and the plan itself. Carolyn, did you raise your hand again?
I did. This is
Thank
just
you.
was a segue right into
This
what-
perfect segue.
So thank you, Amanda. One of the things that very clearly we run into as a rural region, I'll be very frank here, less than 2% of our population in a 26,000 square mile is composed of persons of color, tribal nations, Latino population. Yet that is where the greatest requirement for these financial resources is falling. And because there is such a small voice in comparison to the majority population, they are often left behind. And I think that message is coming through from some of the individuals on the call today. Our efforts with the coalition that Callie just graciously mentioned, thank you for that, Callie, but our efforts with the coalition are very much focused on that population group. I'll give you just a brief example. We recently, as an independent living center, partnered with our brain injury coalition locally. And the result of that partnering means that the brain injury coalition will now have the local resources to reach out to the African American senior population, to the Latino senior population, getting more resources out to where we really require them. We want to do more of that. But again, these agencies are small. They're not going to come to this table because they're intimidated by it. So we're attempting to bridge that gap to make those links so that the monies can get where they're really required.
Thanks again, Carolyn. See, we have in the chat recommendations. Agency should be actively engaged in cultural humility. Whoop, just lost my chat spot. Cultural humility training, resources available for language and translation services, active engagement with the LGBTQIA+ community, using local listening sessions to engage DEI and track SAME. Valerie Coleman stating that this is absolutely critical, particularly with regards to people with disabilities. Thank you for your comments. Anyone else want to raise their hand? Whoop, Pauline Martinez.
Sure. I agree with, all the comments we've had so far about a plan to capture community input from diverse perspectives. And just to add, there's the diverse ethnicity, sexual orientation, and gender identity, but also getting input from diverse caregivers, adults with disabilities, and also diverse age groups. Something that I believe is important, not just like the young old, but also the old, people who are homebound. So really diversity in many different ways, and that can look different, could be via surveys or town halls or listening sessions or focus groups or phone interviews. So just being sure that you're capturing this diverse input.
Thanks, Pauline. Will mentioning that in the chat that many of these populations overlap, so I suggest intersectionality be addressed in the application process. Clay mentions that combating ageism and ableism should be at the forefront of MPA equity and cultural competency efforts. We have comment from Maren Rose about building relationships, taking time and consistency, and their success with Native American communities through providing infrastructure funding, but more can definitely be done. Great, thank you, Terry, for sharing a data resource in the chat. If we have no further hands raised, we can go ahead and move on to question number 5.
Thanks, Amanda. So we're going to switch gears a little bit and talk about funding prioritization and some scoring incentives. So we wanted to hear from you on what criteria do you recommend CDA use to prioritize the funding selections under this grant program to support communities and populations that have been historically under-resourced and underserved?
Rita Sains. Hi, Rita.
Can you hear me now?
Yes.
Okay. So one of the things that, with all the people who have been doing this historically, there is and recognizing the need, it would be our inclination to go to those organizations. One of the things that we might need to consider is an organization that works with these communities historically and has wanted to do aging activities, but hasn't had the wherewithal to do it. So there are two things. One, are we interested in these types of organizations, which have all of the, how to be in contact with your elected officials. They do contact with their community. They're very entrenched in their community. So, but they haven't historically done aging and disability work. So are we saying then that these people will not be considered? Or going back to the SCAN regional groups, important for people to reach out to communities, to organizations that have a historical connection with these communities and include them in their application, either as subcontractors or as partners. So that's the way a lot of community organizations in the past, outside of the aging community, have succeeded in developing cultural cultural competence by including the people who are used to working with these underserved organizations. That's just thought.
Thanks, Rita.
Thank you. And it looks like Dr. Linda Boykins. Let's unmute her line and then we'll go to Jasmine Ford.
Linda, are you there? Let's hop on over to Jasmine and perhaps Linda's audio will be fixed. Oh, there she is. Hi.
Can you hear me?
Yes. Yep. Sorry, Linda, you have some feedback. If you have your phone on and your computer on, if you could turn one of those off. Could we mute Linda? Thank you.
Can you?
Let's move on to Jasmine Ford.
Okay. All right. Am I unmute?
We hear you.
Okay. All right. I worked with One Stop Career Centers when we were doing this under the Department of Labor, creating partnerships to form a system rather than all the diverse doors that you have to knock on to get services. And I would highly recommend, in terms of prioritizing the funding selections, that you must have a real clarity about partnerships. People have to have skin in the game. And it doesn't matter who the leadership is, whether they're a government entity or a private nonprofit, it doesn't matter. But if they partners, then you should list who the mandated entities needed to be that were represented in it. In some way, they needed to show that connection and then to show clarity about the connection. What is the role of those other partners? So that you can actually show you are making a systemic change in how things are going to be, so that it will be easier for the constituent, for the person seeking service or their families to be able to access the cadre of services that you want to see. And I just think that's really important. You've got to reward very carefully that which you call out, that which you want to see at the end. If you're trying to build a system, you need to show systemic linkages that are meaningful with skin in the game.
Thanks, Jasmine. Love the engagement I want to let you know that we do have 5 questions left. We'll go ahead and take the, I think Carolyn was next, and then Pauline. And Rita, I'm not sure if your hand is up from the previous question or comment.
Thank you, Amanda. I'll be brief here. I do agree with what was just voiced. I think what we are finding in our research and in our listening sessions and activities out here present day is that a lot of those underserved populations are not connected with these established service agencies. So as a result, that black hole is getting deeper. So it's not that we want to ignore experience. It's not that we want to ignore systems, but what we're finding is that there is a huge lag still behind the systems that are here and reaching the populations that really require it.
Thanks. Pauline.
Yeah, kind of building on the last question about equity and inclusion, I would prioritize applications that come from agencies representing historically marginalized regions or populations. And I think it'd be really great, sounds like there's a lot of engagement from the rural communities. So ensuring that a percent of the awards go to rural or frontier communities.
Thanks, Pauline. Okay, we'll go ahead and move on to question 6. Wait, 6? 5? Funding prioritization and scoring incentives. So this question asks, what additional factors or criteria do you recommend CDA use to award applications scoring incentives? Carolyn?
I have a lot of thoughts this morning.
Love it.
I want to piggyback off of Pauline's comments about the rural communities and add into that the possibility of some demographic perks, because oftentimes these larger grants come in and the favor goes towards larger metropolitan service areas because of the calculations coming in through population. So I'd like to strongly recommend that there either be point incentives for the rural areas or that population be removed as a criteria, because it throws a balance in where the rural regions just cannot compete.
Homage, no?
Good morning. This is Talmadge House from the PFILC, Statewide Community Organizing. I would like to know if grantees are writing in for community organizing specifically, or are they just writing in to fill in a grant? Are they putting in a specific amount of time for this outreach? Because that's where a lot of individuals are losing that funding at, because they don't have the funding for the manpower to go and do this outreach. And with a lot of centers and individual places being short-staffed at this moment, and we're still opening up, I think that grantees fishing for the monies should think about putting monies into writing it into outreach and putting in for affording the manpower that we lack the funding for. Thank you.
Thanks, Talmadge. Toria.
Thank you. For this question, to award application scoring incentives, well, an organization may or may not be able to prove that their idea is more unique or has a less served group. But if the board, if the CDA looks at what is also going on in that county or that region, in other words, you might know what the Board of Supervisors at a county is doing, and the organization may be doing something that duplicates it or not. Those are the types of considerations that would be factored in. May be difficult to implement, but we should give some consideration to checking up on the uniqueness or the under, the how well an organization is addressing the issue in their area based.
Thank you. And the individual using Ophelie's account.
This is Ophelie, actually.
Hi.
I also wanted to agree with what Caroline mentioned for rural communities. I feel like sometimes it's all about the numbers and where the most population can be served, but oftentimes the places that are rural, inaccessible by transportation, or have no grocery stores, or just very out there with not a lot of services. And yeah, fewer participants can be served there, but are also just as important as a big conglomeration or big city. So I just wanted to also say that. Thank you.
Thanks. All right. I believe we can go on to question number 7, Jackie.
So this next question is focused just on like some administrative and fiscal reporting requirements that we're looking into. So we wanted to hear from all of you on the call. Are there any issues or concerns that CDA should be aware of in advance if the selected grantees are required to submit quarterly invoices for reimbursement? Please share your thoughts and comments on that question. Rita, let's unmute your line.
Yes, I'm involved in the ADRC committee that CDA has put together to take a look at that, and the 2030 committee. And I want to encourage CDA to try to be as uniform as possible in both collecting metrics on these programs and in any type of accounting and invoices, so that organizations don't have, several different ways that they have to bill CDA, and they don't have not conflicting, but as standard as possible metrics, so that we're taking a look at the whole picture in as uniform a way as possible.
Thank you.
Our good friend Carolyn.
I'm dangerous this morning regarding the thought of quarterly reporting. Again, I think it's and reimbursements. I'm sure this is reimbursement based, but again, we must think about those smaller agencies who well deserve these types of monies to flow in, that just do not have the cash flow to operate if we're looking at quarterly reimbursements. So if we're going to do that, it would be important to look at least a portion of the awarded monies coming in as an advancement, so that they can begin that pot of activity and have it well funded from the start.
Thanks. Hopefully. Okay. Great. Still more chats coming in. Thank you for those. We'll go on to question number 8.
Hello, can you hear me?
Oh, hi. Yeah, go ahead.
Sorry, was trying to unmute. I was thinking about quarterly reports and just thinking about my team. I think that we already submit quarterly reports for other grants and funding for other programs, but I do want to encourage also CDA to think about, again, yes, streamlining this, something that's easy to put together, because more often than not, small organizations that are doing the heavy lifting are understaffed, especially during the pandemic. So I think that the easier the reports are, the better. And I know you guys want the data, right, to be able to provide this funding. And also what the previous person mentioned about doing some upfront or advanced payment as well to continue running these programs.
Thanks. Okay, we will move on to question 8, grantee activities and resources. We are asking, what are some recommendations for required activities that the selected grantees should complete to plan and develop their local age and disability friendly action plan? Carolyn.
Yeah, I've been waiting for this for this morning.
Oh, I'm glad.
One of the things that this is where I agree with previous comments about agencies, especially smaller ones, getting connected to the larger established organizations and service municipals. There is strength in numbers. There is power in numbers when you have more voices coming together collectively with that common vision. This is something that, as a regional coalition servicing 9 counties, we have been actively working towards into our second decade of activity. It takes time to build those relationships and to have smaller organizations come forward with the trust to know that what they have been working for on a local level will not be overtrodden by a larger agenda. So trust is critical here. But I do think that part of that required recommendation and activity would be that they get connected if they are not already connected at application. Who are they going to connect with? Who are they going to collaborate with? And then have some accountability, forward movement into the grant reporting to show that they're following that path.
Thank you. Okay, let's go ahead and move on to question number 9.
So for this, one of our nearly last questions, we wanted to hear, are there any existing resources that selected grantees should be encouraged to use to help plan and develop a local age and disability friendly action plan? Share some existing resources in the chat, or let us know if you want us to unmute your line.
Ms. Carolyn Nava.
Well,
Again, I'm going to put a shout out with Callie's earlier comment about the coalitions that are throughout the state that are funded by the SCAN Foundation. There are more than 20 of them. Callie, pipe in if you can, please. I believe there are currently 23 coalitions, and they pretty much blanket the state. And getting connected with those coalitions is truly a grassroots way to understand what's happening in this arena. We have been focused on the master plan for aging for several years now, right along with the state following this process, and are very actively working now in our regions to establish that localized master plan for aging presence. It's a great way to get your cause out on a bigger level with low expense.
Thank you. Let's see, a few people in the chat have mentioned the MPA local playbook. The area agency on aging needs assessment and area plan been mentioned. Okay, I think we can move on to our final question. Additional inputs. So do you have any additional feedback or comments to share with CDA to inform the development of our MPA local aging and disability action planning grant programs competitive RFA? That was a mouthful. Maria has her hand raised.
Yes, good morning. This is Maria Magaña from CISO. I'm a community organizer at an ILC, an independent living center. And I'm a big advocate of instead of having to recreate the wheel, use a wheel that has been already successfully implemented. I placed a little bit on the chat. And looking at some of the catchment areas that are very similar to the one that I represent in the Central Coast, I would like to see some of the implementations and or handouts or strategies so that I can use their successes to create success in our catchment area. That would be some of the feedback that I would like, because then it feels that you're starting from scratch when you already have successes within the state. Over.
Hopefully.
I think it's super important to remember that the CBOs or nonprofits or local agencies know what's best for the community. I think each organization spends a lot of time surveying participants, asking the community, what do you need, and working with participants. So I don't think that there is one size fit all for all agencies all over California. I think it's a very diverse state, obviously, and there's many ways that things can be done. So I think, not having limitations in those ways can be, sometimes grants can be limited in what can be done and can't be done. And I think it's important that at the core of it, it's the participants who are going to be receiving the service that are in the center of, of what should be the grant, not the CBOs.
Thank you. Rita.
When I was running the Department of Alcohol and Drug Programs, we often split up grants into small, medium, and large communities. So that might be something we want to consider.
Thanks, Rita. Callie.
And I just want to not that it's fun to watch yourself on YouTube. Thank you, Maria, for sharing that YouTube link of the webinar from yesterday in the chat. Maria and one of the participants put in the chat asking if some of the folks that have spoken up today could share some of the resources. And I know that Pauline was very generous to share many resources that the Northern California Coalition, Carolyn, who has been so participatory today, has talked about, but as well as the Inland Empire and the Central Valley tools and steps that they have taken. So if Maria chooses to put the YouTube link in the chat again, that could be a resource to those on the call today. Thank you.
Thanks, Callie. Wow, we are at time. So I really appreciate all the input that you have provided, and Jackie's going to wrap us up.
Yes, I want to echo Amanda's sentiments. A lot of activity verbally as well as in the chat log that we're monitoring. In terms of next steps, I'm going to post again super quick. We did release a local MPA Aging and Disability Action Planning Grant Program website, and so I provided the link there. On that link, you will also find the survey that essentially has the same questions that you will walk through today. So if you have additional thoughts after today's meeting, or maybe you have some colleagues who weren't able to attend and you can extend the invitation for them to provide their input and thoughts. We are asking that you submit the survey by Friday, December 23rd, and we will again do a follow-up email with the direct link as well. So please, we encourage you to bookmark the new local grant webpage so you can get some information about the program as it's developed, including important dates and any updates. And then as a reminder, we will, the recording of the session will be posted to our CDA YouTube channel and linked to the MPA webpage along with the slides and transcripts. So we do want to thank everybody for joining us this morning. Thank you for your time, your insights, perspectives, incredibly valuable as we launch into this new program. I want to wish everyone a safe and healthy holiday season and a wonderful happy new year. And if you would like to know more about California's MPA, we provided you the link here as well. So thank you for your time and have a wonderful day.
Bye, thank you.